Okay, we're going to go ahead and get started. Thank you, everybody, for joining us. We'd like to welcome you all to the Green Cleaning and Infection Control webinar. We're excited that you all could be here and hope you enjoy this webinar. So my name is Alex Scheibel, and I'm the Writer and Policy Analyst at Healthy Schools Campaign, which is the organization that's hosting today's webinar. We'll tell you a little bit more about Healthy Schools Campaign in a couple minutes, but first I wanted to quickly review some basics for today's webinar. First, we would like to thank our sponsor, SCA's Torque brand. We appreciate their generous support and for making this webinar possible. Next slide. This webinar is the second in a series of green cleaning webinars that Healthy Schools Campaign is hosting this summer. And so in addition to this webinar, we'll be hosting 3 more coming up in the next couple months. And you can register for the other webinars by going to our website, and we are sending out the link to that website now. So if you're interested in joining us for our remaining webinars, go ahead and register for those. Next slide. We'd also love you to join the ongoing conversation that's taking place around these webinars. You can follow us on Twitter using this hashtag to read more questions and answers that are coming in related to these webinars. And feel free to send in more questions that you think of following this webinar. Next slide. Just a few logistics. Today's webinar is going to run approximately an hour, and we're going to be recording this webinar. And we'll make the recording available following the webinar today. We'll email out a link, and then the webinar will also be archived, again, on that greencleanschools.org website that we just sent the link out to. And also at the end of the webinar, if you could just take a minute to complete a quick survey about the webinar, we would really appreciate it. Next slide. So at the end of the webinar, we'll be saving 15 minutes for a question and answer session. And you can ask questions in 2 ways. You can type a question into the questions box located on your control panel and click on the send button. And you can send those questions in at any time during the presentations, and we'll just collect them and save them and answer them in the final 15 minutes of our webinar. Or you can also save your questions until the end of the presentation and ask your question over the phone by virtually raising your hand during the question and answer session. And to raise your hand, you can just click on the hand icon on the sidebar of your control panel, and we can go ahead and unmute your phone so you can ask your question live over the phone. Next slide. So we have a great lineup of speakers for today's webinar. We're joined by Mark Bishop, who's Healthy Schools Campaign's Vice President of Policy and Communications, Donna Duberg from St. Louis University and the Torque Green Hygiene Council, Mervyn Brewer from Salt Lake City School District, and Deb Stafford from Green Chimneys School. And Mervyn and Deb are winners of the Green Clean Award, which is an annual award co-hosted by Healthy Schools Campaign, the Green Clean Network, and American School and University Magazine. So we'd like to congratulate them for the wonderful green cleaning programs that they've set up and encourage anyone who's interested in applying to go ahead and download the application from American School and University's website. And Mark just sent out the link to that website, and the 2011 application was just posted last week. So we look forward to hearing from you during the Q&A session, and thanks again for joining us. I'm going to turn it over now to Mark, who will be providing us with a brief intro to green cleaning and today's webinar.
All right, thank you so much. Thank you again for everyone for joining us today. First, I'd just like to start by giving a little background about Healthy Schools Campaign. Healthy Schools Campaign, we are a not-for-profit organization. We've been around for going on 10 years now, which is amazing how time has flown. But we work on the intersection of asthma and obesity within the school environment. But specifically on asthma and the indoor environment, we work on a big part of our program work is around green cleaning and trying to help schools identify ways to reduce toxic chemicals that they use in their cleaning programs, so we have ultimately a cleaner environment for everything. Our green cleaning program, I'd like to highlight 3 areas of it. And the first one is that it started here in Chicago where we are located. We started with Chicago Public Schools trying to get them to adopt policies to reduce the toxic chemicals that they are using. And after a successful campaign, we were able to do so, and which then led to the creation of a guide on how schools can implement green cleaning programs. And I'll be speaking about our quick and easy guide to green cleaning in just a few moments. But the important piece of that guide is that it's rooted in real-world applications, and it's rooted in the lessons learned from a large school district who went through the process of trying to change change their systems and figure out how to adopt healthier, more sustainable cleaning programs. The next step of it is really focusing on state policy and making sure that our policy makers and our policy leaders understand the importance of reducing the toxic chemicals in our cleaning programs and how they can take steps to ensure a healthier environment for our schools. And we do so by, again, engaging with policy leaders and making sure that they recognize these links and creating policy recommendations for healthier environments. Finally, at a national level, we want to make sure that national organizations, that our national leaders are all taking their step and doing what they can to make sure we have healthier environments for our kids. Our quick and easy guide to green cleaning in schools, again, we published this first in 2006. This is really our strategy for engagement with a broad set of stakeholders and for doing education for parents, school administrators, for companies who are involved, and really identifying how we can push forward both the demand and supply for green cleaning programs. In addition to the publication that we put together, we have our website, greencleanschools.org. We have quarterly newsletters. We do promotions around green cleaning. We do speaking engagements. And, of course, we have webinar series that we try to do our best to promote green cleaning and as broad as audience as possible. You know, we engage with national organizations who partner with us to help reach out to their partners, and their members, which really helps us leverage our networks and help us leverage the reach that we have in getting the word out about green cleaning. So we don't see this as us working in our own. We see ourselves working with a vast network of committed individuals trying to improve the health of our nation's children. So why do we talk about green cleaning? And what is green cleaning? Well, from our perspective, green cleaning is cleaning to protect health without harming the environment. Cleaning, the reason why we clean our buildings is to protect health. It's not to have shiny floors. We want to make sure that we're reducing diseases that are being spread. We want to make sure that teachers are healthy and in the classroom teaching, and that students are in the classroom learning. That's the most important thing that we can do to really ensure that schools are doing what they are meant to be doing, educating our children. But then we want to take green cleaning by taking it a step further by protecting the environment and making sure the environment, as defined broadly by the outdoor environment, that we're protecting waterways and air quality, but also the indoor environment is protected. So we're making sure the air that we're breathing and the surfaces that we're touching are as helpful and health promoting as possible. Why we care, and here are the 5 reasons why we care about green cleaning. By no means is this an exhaustive list, but let me just really quickly walk through it. First of all, it helps students stay healthy and learn. You know, we are looking to reduce those absenteeisms that in school, keep kids in class, and make sure that they're not sick, or at least not sick from areas that we can control by keeping a clean facility and a facility that is limiting the exposures that are possible in a school. We want to protect the health of custodial staff. Of course, our custodial staff are our frontline workers, and the exposures that they potentially have are real and potentially intense. So we want to make sure that these workers are protected and have a workplace that is healthful and protective of their health. Third, we want to increase the lifespan of our facilities. Our schools are, these are institutions that are held in the public trust, that are owned by you and me through our tax dollars. And we want to make sure that we're maintaining them in a way that's going to preserve them and going to keep them in our communities as long as possible. Fourth is preserving the environment. Again, we want to pass a healthy, clean environment down to our children. We want to have a healthy indoor environment for our students. And there is no better way to start by making sure our cleaning programs do this. And finally, fiscal responsibility. If you stick around and hear some of our presentations, not only today but our other part of our series, you'll hear about green cleaning and how the reality is it is fiscally responsible to have these cleanings. It saves us on costs, it saves us on chemical costs, labor costs, and it helps preserve the facility that we are working in. So it is ultimately not just about health, but it's also about fiscal responsibility for our schools. Now, having said that, I'm going to take a moment before I introduce our first speaker, Donna Duberg. I'm going to ask a quick question, make sure to engage everyone, see who is here today. So quickly, I'm going to ask everyone, who are you? If you could take just a moment and answer who you are. And in the meantime, I'm going to introduce our first speaker. So Donna Duberg is an expert in hygiene and an authority on disease prevention. She is an assistant professor of clinical laboratory science at St. Louis University. She has been lauded as a credible media source both nationally and in St. Louis, where she makes reoccurring appearances as a St. Louis germ expert on local Fox newscasts. She is a member of the Torque Green Hygiene Council and a board member of the Missouri Society for Clinical Laboratory Science. So having said that, Don, I'm going to close the poll, and I am going to share it and let everyone see who is here today. And it looks like we have a lot of others. 9%. We've got a mix of school administrators, custodial staff, manufacturers, distributors, and then a big chunk of others. We're going to have to refine our poll to make sure we can get down to that a little bit more detail. Having said that, thank you so much for taking the moment. And now I am going to ask Donna to get started. Donna.
Thank you, Mark, for this opportunity to discuss the benefits of hand hygiene and green cleaning and the role they play in providing healthier and more productive environments for both students and employees. School wellness programs currently focus, School wellness programs currently focus on nutrition and exercise only. When considering the idea of wellness, we should also include other issues which impact general health in an effort to reduce school or work-related illnesses. Administrators should put in place initiatives which address hand hygiene awareness and proper green cleaning practices. The goal should be to provide a clean environment in our institutions and to teach clean living habits. A very light touch on that. Infection control really does matter, as is seen in recent research reports. When a daycare center in Belmore, New York implemented deep cleaning protocols in their institution, they found that there was a 24% decline in total illnesses. The number of doctor's visits declined by 34%, and antibiotics were used 24% less often. There were 46% fewer days missed. When an elementary school in Washington, D.C. underwent a major building renovation, they also revised their cleaning methods. They improved their indoor environment, resulting in improved student performance. There was a 51% increase in the number of students passing the standardized math test and a 27% increase in those achieving a passing reading score on those standardized tests. Administrators noticed a 4.5% increase in attendance. The Syracuse, New York Public School District improved its cleaning strategy and was rewarded with an increase in attendance of over 11%. Since funding is tied to attendance, the district received an additional $2.5 million. So, what is cleaning? Cleaning usually involves the simple removal of dirt and grime. On most surfaces, these soiled areas are usually visible to the naked eye, or perhaps the dirt is hidden deep in carpets and fabrics. Cleaning may also entail leaving the area as germ-free as needed. Killing action in most hospitals are at the 100% level and may require sterilizing. But in your institutions, it may talk about sterilizing dishes, pots and pans that are used in food production and serving. But after sterilizing, these items will still be exposed to airborne contaminants such as dust and bacteria. Disinfecting is killing bacteria and viruses at the 99.99% level, while sanitizing is cleaning, which is 99% effective in removing these infectious agents. Some cleaning agents can be both disinfecting and sanitizing, depending on the length of time the treated area remains visibly wet. These products are usually used for the general cleaning of bathrooms, kitchens, and hard, non-porous surfaces such as handrails, doorknobs, counters, and so on. So clean enough as it relates to infectious agents may be explained as the area is just visibly free of dirt as would apply to the general cleaning of carpets, drapes, furniture, and equipment. How would we go about implementing a green cleaning and infection control plan? First of all, you must specifically write out your green cleaning policy and be specific as to the goals you expect to achieve. When establishing a committee, the lead person of that committee should have the authority to make changes. For the restaurant industry, we could take a lesson in that there are programs that provide training and certification for individuals to serve as certified kitchen managers. So if your institution has a food production area, you might consider this route. Evaluate what you are doing now with an eye for what could be improved. Design a pilot program and start with small projects. As far as monitoring the change, compare your indicators at the beginning of the program and a set time down the road after all the products have been switched over. In educating your employees, be sure to include the why. Why are we making these changes? And why are these changes expected to improve our workplace? Understanding the reasons, and especially the outcomes of the changes, increases the probability of compliance. Phase in green products as the current supplies are used up. Monitor the workplace and take advantage of opportunities to make green purchases. And as you reach your goals, celebrate your successes. Make sure that the reward is something that's of value to the staff. Okay. Training employees on green protocols can be helped by organizations such as ISA and Green Buildings, which can provide help in this area. Once you have your green cleaning plan identified, a written curriculum must be created which details all the procedures that must be followed. You should document attendance at each of the training sessions, and you should include consequences of not performing the tasks as directed. The training could be provided by the manufacturer of the products that you're using, the distributor of those products, or a third party such as your training department in your institution or your supervisory staff. Wherever possible, use green disinfectants. Factors to keep in mind when selecting green disinfectants include that the cleaning agent should have a moderate pH. It should be as close to 7 or neutral as possible. You should buy concentrated cleaning solutions so that you have less bottles when you bring them into the facility, but we should pay a special attention to the directions for diluting it to its working concentration. Adding a little more may actually inactivate the disinfectant and not allow it to work properly. The disinfectant should contain very little, but preferably no, volatile organic compounds. As far as hand awareness, in the course of the day, our hands pick up many different bacteria and viruses, some of which could make us very ill. Hand awareness simply means being sure we do not touch the T-zone, our eyes, nose, and mouth. These are the portals to our lungs, gastrointestinal system, where harmful germs can cause flu, colds, vomiting, and diarrhea. In addition, good hand hygiene will help keep our hands as clean as possible. Hand washing is preferred whenever soap and water are available. Hand sanitizers can be used, either the alcohol or non-alcohol-based ones. Even the wet disposable cloths will help remove visible dirt and enough germs to keep us fairly safe. So, when should we wash our hands? Well, whenever our hands come in contact with dirty, grimy, or greasy surfaces. So we can remove the gunky stuff from our hands and allow the killing action of the soap to work more effectively. We should definitely wash our hands well before eating to keep bacteria from entering our bodies on the food that we eat. And after eating, to remove grease and food bits from our hands, since these provide excellent places for germs to multiply. There are obvious situations which require effective hand washing, such as after going to the bathroom, after blowing your nose or coughing or sneezing, before or after you've treated a cut or a wound. Definitely after handling animals or animal waste, especially in classrooms that have them present. And lastly, after handling money. Proper hand washing. The Centers for Disease Control has stated that hand washing is the most effective way of stopping the spread of infectious agents. How we wash our hands is as important as when. We should use an adequate amount of soap and warm water. That is, enough soap to make a lather that will last for at least 20 seconds of vigorous washing. Rub your hands together to create a working lather all over, including your wrists, the front and back of your hands, between the fingers, around the thumbs, and under the nails. If your nails are very dirty, use a nail brush. To make sure you are washing long enough, sing. Sing Happy Birthday twice, Twinkle Twinkle Little Star, the ABC song, making sure that you are lathering for 20 to 30 seconds. Be sure to rinse your hands and wrists completely with warm water. Dry thoroughly with a paper towel, which is very absorbent, and you can now use that paper towel to turn off the faucet and open the bathroom door so that we don't contaminate our clean hands. The CDC has free publications you can order or download entitled An Ounce of Prevention. The poster, short brochure, or the full packet of information is geared towards a safer home, but the message fits in any environment. The American Society for Microbiology and the American Cleaning Institute have joined together to produce a brochure entitled Get a Grip on Hand Washing, which could be distributed at school events or the information shared in newsletters or on blogs. Let's find ways to make it fun. Get everyone involved. For example, designate a day of the week or the month when the institution focuses on cleaning surfaces that are frequently touched, such as desks, cafeteria tables, door handles, and handrails. Pick a specific time of the day, like maybe homeroom, and be sure everybody is using disposable disinfecting wipes. The Henry the Hand website is a great place to go to find out about hand awareness. It reminds us not to touch the T-zone, that nose, eyes, mouth, those mucous membranes, explains the cough and sneeze etiquette, and tells us that we could use the sniff test. If our hands smell bad, they are probably germy. There are also educational materials and a calendar of hand washing events, such as Global Hand Washing Day, which this year is on October 15th. The Cleaning for Healthy Schools organization has a toolkit with flyers, posters, and workshop presentations ready-made for use. You can also visit our SCA TORC website to find ready-made posters with information on hand washing in English and Spanish for both elementary and high schools. Employ any of the resources that you have at hand. Keep these important messages in the forefront by disseminating information regularly in student, parent, and employee communications, including newsletters, social media, and communication and community newspapers. Also, display information in key areas of the building, such as bathrooms, cafeterias, and wherever your employees gather. Rotate or replace the posters throughout the school year so the message stays fresh, and use holiday themes to brighten the message. We should always take time to reward our successes. Ask your students and employees what they would consider a treat to celebrate when goals that were made are achieved. Select a gift or plan a party that supports the clean and green theme. Pass out hand sanitizer bottle with the school mascots on it. Throw a decorating party with prizes for those who create the cutest germ face on their cookie or cupcake. Whatever you come up with, have fun. Lastly, the flu season is upon us as we speak. This year's seasonal flu shot still contains the H1N1 vaccine, and we only need one shot again this year. If you had a shot last year, those of us 6 months of age or older should get another one this year. There is no shortage of the vaccine, but the sooner you get the shot, the more time your body will have to mount an effective immune response before you are exposed. Employees should be encouraged to be vaccinated. Thank you for your attendance, or for your attention, and Mark, now it's back to you.
Thank you so much. Thank you so much, Don. I really appreciate it. That was a wonderful presentation. Just one point of clarification. When we're talking about greener disinfectants, of course, we all know that there's no legal definition of a green disinfectant. So the challenge for all of us is to figure out how to do it in the least toxic way and the most effective way possible. And what we're going to hear from the next two speakers are two schools that are doing just that. So before I introduce our next speaker, I'd love to take just one more moment to answer a quick poll question. And the question is simply this: what do you perceive as being the barrier, a barrier for implementing an infection control program in your school? So take a moment, answer this, and I will be introducing Mervyn. So Mervyn Brewer, he's an assistant custodial supervisor for the Salt Lake City School District. He has worked there for 33 years, and during his tenure as supervisor, he's been a key member in building the custodial department's green cleaning program, for which the Salt Lake City School District received honorable mention in the 2010 Green Cleaning Awards for Schools. So I would like to, you have 5 more seconds to vote. 1, 2, 3, 4, 5. Thank you. Close. And if we would like to see, it looks like 68% of you said that the lack of understanding of infection control is the biggest barrier to implementing an effective infection control program, which I think is very interesting. I would love, for those of you who said other, I would love for you to type in those questions and let us know what the other comments are. But in the meantime, I would like to now go to have Mervyn speak to us about his program. So Mervyn.
Thank you, Mark. Go ahead and change to the next slide, please. Let me tell you a little bit about us. There are 36 schools in our district. In May of 1999, a 10-year construction program began to build schools that were safer, brighter, and can be used as community centers after school hours. Our students hail from around the world. Ethnic minorities make up 53% of our students, and the district serves a significant refugee population from Eastern Europe or African countries. Approximately 60% of our students come from low-income families, and just over 33% of them are learning English as a second language. The school district employs approximately 2,840 people, including 1,250 teachers. The district serves approximately 2,400 students, and over 80 languages are spoken in the halls of Salt Lake City schools. So you can see we are quite diverse. Next slide. Thank you. Our green cleaning initiatives are to create a teaching environment that is conducive to learning and provides protection, or a level of protection, of the occupant's health while reducing impacts on the environment. We believe in pursuing an effective approach to cleaning for health that relies on the use of easy-to-follow cleaning practices, united with the use of current green cleaning technologies and employee training that will allow us to also be environmentally sensitive. Next slide, please. Here's some interesting tidbits about schools related to health and cleaning. About 25% of the nation spends their entire day in a school. If you were to also add the universities, you'd be probably closer to 30%. Bleach, while being good for disinfection, is often misused by cleaning personnel. It is frequently improperly diluted, improperly labeled, or mixed with other chemicals that can cause dangerous gases. And in Salt Lake City in 1901, there was a diphtheria smallpox outbreak in our schools. Medical officers responded by spraying classrooms and books with formaldehyde gas. Can you imagine exposing children to that? Back in the day, before we went green, we thought we were doing pretty well with how we were cleaning. But, well, we used bleach 4 times a week in our restrooms, and a quaternary disinfectant once a week, applied by a sponge, rag, or a Johnny mop. Next slide. Back in the day, we would use part-time, poorly trained sweepers, usually youth on their first job, to clean restrooms. Classroom doors were cleaned annually. Latex gloves were used by our cleaning staff. So if you had latex allergies, that wasn't a good thing. And back in the day, carpets were cleaned once a year with the bonnet and buffer method. Biological events, we all can imagine what those are, were cleaned up using a dry powder and a sweep method. Next slide. So back in the day, we used toxic chemicals that were poorly applied. There was a lot of cross-contamination. We used unvested, poorly trained employees to do the operations. If you had latex allergies, you were exposed to all sorts of latex. Our floors were sticky in our restrooms, and they had kind of an unpleasant odor. Next slide, please. So where are we today? Well, since September of 2008, full-time career employees are cleaning the restrooms and locker rooms. No more poorly trained part-time employees. Hydrogen peroxide-based cleaners are used 4 times a week in our restrooms and locker rooms. We do a shotgun cleaning of the restrooms once a week, and that's done with a disinfectant, and that's sprayed on the entire walls and every crack and crevice in that restroom. We use color-coded microfiber rags and compartmentized buckets to use, they're used to reduce cross-contamination. And we also use foaming hand soap. Next slide, please. High-traffic doors and walls are wiped daily. Hard surface cleaners are hydrogen peroxide-based. Spray bottles of peroxide-based cleaners are provided to all classroom teachers for daily desk cleaning. Foaming spray heads are used to reduce inhalation risks of chemicals. Microfiber rags are used. All cleaning operations are done with the use of nitrile gloves, so no more latex allergies. Non-alcohol foaming hand sanitizers are provided at all cafeterias, daycare areas, and severely handicapped units. Our carpets are cleaned by the use of a truck mount carpet extractor. Kindergartens, daycares, and special needs classrooms are cleaned quarterly. Biological events are extracted immediately. Bacteria-eating enzymes are used in this process. Next slide, please. We carry a stock of instant kill claim disinfectants, and that's kept on hand and ready to be deployed at any outbreak of a hot spot in a building at a moment's notice. High visibility and PR and an immediate response is critical at this time when you have some sort of an outbreak. Now, back in the day, we used to communicate kind of like in the Stone Ages. We would use pagers to call our custodians. They would have to call us back and respond that if there was some sort of a problem, and we could try and help them manage an event, some sort of an outbreak event, the best that we could. It was a very slow process. Next slide, please. Today, however, we've evolved. We have instant two-way communication through our Nextel radios. We also have custodians who are highly trained, who know how to use email. They're computer literate. They can get on the World Wide Web, and they can find information on the web. They can go to a shared district intranet drive and get information that we post there for them, tech sheets, bulletins. We also have security cameras in our buildings, and how that helps is we are able to manage multiple events in multiple schools and help vector our custodians to the proper areas and actually supervise the operations that they are doing from one remote location, which is very helpful in managing such events. Custodial training is very important. Our custodians receive quarterly training in the latest cleaning methods, chemicals, changes in chemicals, IPM, which we'll talk about in a few minutes, IPM measures, and indoor air quality and other updates. Next slide, please. Now, I mentioned IPM, Integrated Pest Management. This is a quote from one of our assistant principals in a high school who, when we went out to investigate a bunch of mice and other droppings, we were trying to find out where they were coming from and what kind of problems they may be causing. And she wrote this quote. It says, "Again, I can't emphasize how much we need to act. The amount of roach and mouse excrement I saw today is untenable. No teacher or student should be in this kind of environment. Let's stay out of the news, clean house, and get rid of couches." Next slide, please. So what is integrated pest management, and why is it important to infection control? Well, integrated pest management is an effective and environmentally sensitive approach to pest management that relies on a combination of common sense practices. IPM programs use current comprehensive information on the life cycles of pests and their interaction with the environment. This information, in combination with available pest control methods, is used to manage pest damage by the most economical means and with the least possible hazard to people, property, and the environment. Simply put, keep them out, don't feed them, and if you do have them, eliminate them in the least toxic way. So this helps to keep the risks of pathogens carried by pests down considerably. Preventative measures are taken in classrooms daily to keep pests under control. As you know, rodents and other pests can carry these diseases to our students, so it's very important we keep them under control. Our restrooms and shower rooms nowadays, well, they don't smell of cleaners or of chlorine anymore like they used to. The floors are not sticky like they used to be. Employees are no longer exposed to latex or chlorine gas. Next slide, please. Some green chemicals are less expensive. Glass cleaner, graffiti remover. Changes in process and equipment combined with a change of chemicals can save you your labor costs. One other thing I want to add about our IPM program is that we use a whole lot less chemicals as far as pesticides than we used to. In fact, we used to have 100 or so applications in our buildings every year, and in the past 5 years, we've had a total of 14 targeted pesticide applications. So we've cut down the number of pesticides, which has in turn helped the asthma with our children in our school district. Thank you very much. And back to you, Mark.
All right, thank you so much, Mervyn. That was a great presentation. There's so many points you can make, but I'd love to pull out 2 quick points. The first one, I thought was really interesting how you positioned your cleaning program as part of the educational team, and talking about how, as a custodial staff, you guys can work to provide the healthiest learning environment possible. And I think that's really important as we try to identify strategies to really prioritize cleaning and cleaning for health in particular. So I think that's fabulous. And the other thing I think was interesting was the importance that you talked to of having a communications plan in the case of some type of outbreak and being prepared for that. So thank you so much. Now, before I go and introduce our next speaker, Deb Stafford, I'd like to have one more quick poll question. So if you all will just take, again, a moment and answer the following question of what you believe is the what do you believe is the most important way to begin a infection control program as part of your green cleaning program? And in the meantime, I will introduce Deb Stafford. Deb Stafford is the Director of Housekeeping at Green Chimneys Schools in Brewster, New York, and she's currently leading Green Chimneys' green cleaning program. Green Chimneys School is world-renowned for its animal-assisted therapy program, residential treatment center for children, and accredited special education school. The cleaning program at Green Chimneys Schools received an honorable mention in the 2010 Green Cleaning Awards for Schools. So let me close the poll. As we're seeing, it looks like most people here are showing that a hand washing program, they believe, is probably the #1 step in trying to promote a greener infection control program in that school, and it makes a lot of sense. All right, I'm going to hide that, and now I'm going to ask Deb to get started to share what's going on in your school.
Thanks very much, Mark, and thanks for the chance to share what we have learned with all of you. Let me begin first with a little background of who we are. Green Chimneys Children's Services has always been an environmentally concerned community. Next slide, please. What began as a farm and summer camp over 60 years ago, connection to our environment is a cornerstone of our policies and procedures. Working with animals as a way for emotionally injured children to connect, open up, and heal, environmental stewardship remains a major component of the Green Chimneys therapeutic community. In that time, Green Chimneys has grown to over 100,000 square feet of cleaning area. A few years ago, we began to transform a traditional housekeeping department where bleach and other chemicals were the basic cleaning arsenal into our present-day green cleaning initiative. With 200 students, most with emotional, learning, and social challenges, keeping the school clean was a major challenge in itself. Next slide, please. The first thing we did was to purchase several hundred square feet of walk-off mats made from recycled rubber and plastic bottles. The mats are instrumental in our effort to keep the dirt out of the buildings. But keeping the dirt out was only the beginning. We have more than 30 buildings that include classrooms, restrooms, hallways, the dining hall, kitchen, more restrooms, the gym, locker room, pool, and even more restrooms. We have an animal farm, a horse barn, and even an organic garden. As you can imagine, the campus is very diverse. Each area requires a distinct level of cleaning and disinfecting. By using a few specific green cleaners and closed-loop dilution systems to deliver the proper cleaner, Green Chimneys has implemented more efficient and safer cleaning procedures. Additionally, because of bulk purchasing, pricing remains competitive and shipping costs are greatly reduced. Our housekeeping supplies budget has decreased 20% over the past 3 years. Next slide, please. But Green Chimneys is about people. Lots of people. We have 102 residents, more than 100 day students from many area school districts, and all the staff it takes to run this place. The nature of our business also means we are exposed to germs, lots of them. So what, you may say, is the question? Well, the question is it possible at all to use disinfectants in a green cleaning program? Or does the need to protect students and staff from infectious disease more important than the demand for green cleaning? As we heard Mark tell us earlier, green cleaning is defined as cleaning products that work effectively while minimizing adverse impact on human health and the environment. Next slide, please. Well, the answer is yes. We are able to minimize infection and maintain a clean, healthy environment through specific procedures in our infection control plan. The ICP begins with the routine cleaning, sanitizing, and targeted disinfecting, but also includes specific steps to take in the event of an infectious disease outbreak. Because of our unique population here at Green Chimneys, routine cleaning means more than just making areas look clean. Next slide, please. We heard Donna say that the Center for Disease Control has specific definitions for cleaning, sanitizing, and disinfecting. And the amount of germs that they work with is according to the amount of cleaning that you need at the time. Regular routine cleaning removes the germs. So a lot of times that's your first base of war against removing the germs. Sanitizing lowers the number of germs, and disinfecting kills the germs. Next slide, please. Our ICP designates high-risk areas that may require sanitizing and targeted disinfecting in addition to routine cleaning. High-risk areas include door handles, hand railings, lockers, shared desks, and keyboards. Targeted disinfecting is when you only apply disinfectant to those areas and you don't flood the entire school with any kind of disinfectant, which actually is really just a pesticide. We also have a specific list of approved products. There are detailed procedures, such as dwell time and frequency. We employ the practice of simply spraying high-touch points with an EPA-registered disinfectant and leaving it to air dry. In this way, the prevalence of germs is minimized. Additionally, having hand sanitizers available when water is not can help us feel we are diligently maintaining a high level of hand hygiene. In order to execute an infection control plan, there must be staff designated and trained in these procedures. Training continues with respect to equipment safety as well as consultant training and hands-on practice. Custodians and janitors are vested in the outcomes of their work, and training helps them to be experts in the field. This has lessened resistance, improved morale, and because of the diversity within the housekeeping department, procedures are often used pictorials to simply explain many of the steps. Next slide, please. The procedures. Most of our procedures are followed on a daily basis, as we routinely use no-touch cleaning systems, automatic floor scrubbers, and increased hygiene awareness, and effective implementation and installation of hand sanitizer stations at all of the entrance and exits of specific locations, such as our farm, our dining hall, the computer lab, and library, as well as in the classrooms. Not too long ago, I was on a New York State PTA Healthy Schools conference call, and the PTA president mentioned the concern of many parents had regarding the use of disinfectant wipes containing bleach and how they were being used everywhere. That is a very toxic procedure. So as we heard earlier, rather than use bleach, try to use a quaternary formula, one that is recommended by the EPA, with kill claims to the specific infection. It is important to remember, too little does not work and too much is toxic, whether you're using bleach or a disinfectant. Next slide, please. Using the proper tools and communicating a clear solution is as important as outlining the problem. In addition to meeting strict health and environmental standards, green cleaning products must clean as effectively as traditional products in order to receive certification. Environmentally preferred and green cleaning products are terms often used to describe new formulas of cleaning products that are alternatives to conventional ones. Recognizing that neither of these labels eliminate all health and environmental risks, switching to a third-party certified green cleaning product can provide schools with a straightforward way of sifting through all the greenwashing. The logistics of that include using the proper tools and product for the job, such as non-ammoniated glass cleaner for glass, not toilets, color-coded microfibers that are washed and disinfected, no-touch cleaning systems using disinfectants. A very major part is using the proper dilution system, and your supplier should help you regulate and monitor the parts per million of your dilution systems. I'll say it again, too little doesn't work and too much is toxic. Presently, there are no Green Seal certified disinfectants. As the disinfectants kills germs, they're considered pesticides. Next slide, please. The specifics. Gloves, masks, and other PPE equipment are integral to the ICP. Along with hand washing, gloves are the first line of defense in preventing the spread of infection, especially in school and residential settings. Gloves reduce hand contamination by 70 to 80% and prevent cross-contamination. Studies show that no-touch cleaning systems are 60 times more effective in reducing bacterial contamination on tile and grout surfaces than mops. That's the kind of shotgun approach that Merv was speaking to later, where you can hit the walls and the floors and every little nook and cranny. However, the use of gloves does not eliminate the need for hand hygiene, nor does the use of hand hygiene eliminate the need for gloves. Many times, the gloves are protecting your staff from the hydrogen peroxide used in many of the disinfectants and chemicals we use today. Next slide, please. Some of the added benefits green cleaning itself provides include a close to 35% reduction in daily water usage here at Green Chimneys. We are in a wetlands area, and reducing our water usage was a major impact, and a positive one at that. We also reduced cardboard recycling costs 50% because of less packaging, less deliveries, and less waste. The housekeeping department utilized a Survey Monkey for a campus-wide survey regarding housekeeping standards and quality with positive results and helpful feedback. 81% said go green. It is most likely even higher today. We do a lot of communications to students and parents and staff through emails and letters sent home. We emphasize the benefits of hand washing at our school morning announcements, post reminders at all locations, and believe educating the whole community is imperative. Next slide, please. So in the end, a green cleaning program can be very effective at fighting the spread of germs even in such a varied and diverse campus as Green Chimneys. By exercising prevention, increasing education, and diligent execution, our Green Chimneys community has attained and maintained a healthy environment we all deserve and have come to expect. And that's about it. So thank you very much, and now back to Mark.
Thank you so much, Deb. That was fabulous. That was a great presentation. I think one thing that's really interesting is there really is no one solution for any single school, and what we have to do is make sure we all share the information to the best of our ability, and schools have to really work hard at implementing this. And we heard at least 2 really great case studies of what schools are doing to address infection control through their green cleaning programs. I would also like to really quickly just pull out one more plug for the Green Cleaning Award for Schools and University with our partners at American Schools and University and the Green Cleaning Network. By all means, please, we've pushed this before, but if your school is interested in being recognized for green cleaning excellence, or if you know of a school or if you're working with a school, please let them know, because the award applications for 2011 awards are already up, and we'd love to see you apply. Having said that, we'd love to now take the next few minutes for Q&A. I know a number of questions have come through that Alex has been sorting through, and so if you'd like to send in a question through chat, through Twitter, or ask over the phone, just let us know. And Alex, would you like to find the first few questions?
Sure. So we're actually going to start with one for Deb, since she just finished up her presentation. We had a question asking who or what is the source of training used at Green Chimneys?
We find that our consultants and suppliers are really anxious and helpful in providing the dilution systems and the training. I work really closely with the consultant here, and he's been instrumental in making sure that we use the proper product for the right procedure and the right dilution systems. So I would definitely speak to your supplier or your vendor and see if you could get some hands-on training through them.
Wonderful, thanks. And then we have another question which anybody can feel free to answer. How often should we be thinking about cleaning our gym mats and other PE-related items, and are there special procedures we should be thinking about?
Well, I can answer that. I would recommend that gym mats, things such as that, should be cleaned before each use. And we would use, what we have used in the past, is a disinfectant. That's one of those targeted areas that we want to make sure we get the proper dwell time. And remember that as you look at disinfectants, as you look at hard surface cleaners, all of them will have on their efficacy charts dwell time. That those items need to dwell to actually get the kill claim that they are after. So it's very important that you think in a process ahead of time to put something on those mats in enough time ahead so that it will dry. It will be able to sit there to actually kill what it is you're after.
And I advocate it.
Go ahead, Donna.
I could probably add in there too. You're looking at mostly methicillin-resistant Staph aureus, commonly seen in a lot of our infections and our wrestlers. And you need to make sure that you apply it to the seams. You need to watch to make sure that your equipment's in good repair, that you're not getting any cracks or and MRSA, again, paying attention to what you call the dwell time, that needs to be wet for the entire time that they're saying. So, I mean, if you put it on and it tells you a 4-minute time and it's dry after 3 minutes, you need to re-wet it.
Yeah, very important point.
Great, thanks. And then one more question. Somebody would like our speakers to discuss how paper towels compare to hand dryers, and specifically how that relates to infection control.
I guess that would be me. There is some literature out there, and usually when they talk about hand dryers, they usually mention that it's almost as good or as good as paper towels. There's a couple of issues. One of them is how long people actually use the hand dryers for. most people don't usually use them long enough until their hands are completely dry. And then you're simply just leaving moist hands that, again, become a very quick breeding ground. Paper towels have the added advantage of being very absorbent up front, and then you can use them to turn off the faucets and open the doors. And again, for positioning of waste baskets, you should have the waste basket close to the door so the person can open the door and throw the paper towel away. The new hand dryers too that are actually blowing the air up are actually aerosoling the water that's on the hands. And so there's going to be some studies looking at the spread of that aerosol spray onto counters and floors, and definitely again being inhaled. So.
Sometimes you have, this is Debbie, you have to sometimes weigh the good with the bad because we use the hand dryers here in our new dorms, which are going for LEED Silver certification. And the reason we do that is because the children just love to put paper towels down the toilets. So we usually have them use the hand dryers, and then if they need an additional paper towels handed out by staff. So that's kind of how we handled it here at Green Chimneys.
Definitely, yes.
Great, fantastic. So another question. Don't you have to clean with a cleaning product first before using bleach to disinfect? And that, yeah. So, okay, so feel free to discuss.
That's what's recommended. However, what we use is a hard surface cleaner that does have hydrogen peroxide in it that does give a certain amount of, again, we look at the efficacy to see what its kill claim is, and that's what we use. Now, if you were to, the question is very valid that, yes, you do need to clean a surface first before you were to put, say, bleach on it and try and kill it. But we try to kill two birds with one stone with the way that we do our cleaning process. And in using the microfiber rags, that picks up the soil and the dirt as we wipe, as we clean.
I totally concur. I'm sorry. I totally concur with Merv and many things that he does in his presentations we do at Green Chimneys. And that's where routine cleaning comes in, because if things are in a relatively clean condition, then doing the two steps as one works pretty well.
CDC always contends that you need to remove visible dirt first. If there's not excessive visible dirt, then any standard disinfecting, as long as it's left on long enough, should be effective.
Okay.
Great. And now we have somebody who's raising their hand in the audience, so we're going to go ahead and unmute Phil's phone. If we can.
Oh.
Okay, Phil, you should be live right now, so go ahead and answer your question, or ask your question. Phil?
Okay, it seems like Phil is not able to respond. So let's ask one more question.
Okay, we'll go ahead. We have a question that is specifically about foam hand soap, which I know came up during the presentations, and it's from a person that looks like they have difficulty getting young children to wet their hands before applying the soap. So maybe if somebody could speak about strategies that they've done to make sure it's used effectively. And this person wants to know if the concentration of foam hand soap is harmful.
Well, I guess I will do what I can with that. Quite often in kindergartens, they do have problems because they are so many kids in a class to one or two teachers, and they can't police them real well in making sure they get their hands wet ahead of time. So we use a foaming hand sanitizer, and the reason we go with non-alcoholic is, well, I don't really want to put something like gasoline or something flammable around our students. If you've done any tests with lighting that stuff, it actually burns pretty well. We really have decided to go with the non-alcoholic base, but we found that there's been no need to wet the hands ahead of time with the foaming product. It gets the hands plenty wet and seems to work just fine with what it's designed to do.
And you certainly don't want to use too much alcohol with children. I mean, on occasional use, for example, if you're in the car traveling before they eat fast foods, but you certainly want to reduce the amount of alcohol contact with young children. But it really is effective if you could get them to wash with soap. I mean, if you could use a liquid soap, especially one of the dispensers that automatically dispense the appropriate amount, and teach them to lather. And you know, I gave you a couple of really cute songs. They really get into it if you make it fun. But soap and water, soap and warm water, is the most effective way to certainly clean their hands. And children put their hands all over everywhere and then all over everything. So.
Great, fantastic. And we actually, Phil has typed in his question. It looks like he doesn't have a mic, so this is going to be our final question. It's a point of clarification for Donna. Did Donna say that Wipe Down Wednesdays, everyone should use disposable infecting wipes, including students? Question mark.
Wipe Down Wednesday was just an example. The idea of disposable wipes is usually easy to distribute. And again, the idea of removing as much visible dirt and keeping counters wet enough to use the disinfecting agent that you're having in there. The disposable wipes are just handy. They're the easiest way instead of having to use buckets and recycling cloths, because they're going to have to be washed and laundered, and the temperature has to be monitored for all of that. So it's just a very easy, quick way. The teachers can have the disposable wipes in the classrooms and the cafeterias, and somebody can use them as they're walking up and down the rails and doing the door jams.
Just as a point of clarification from Healthy Schools Campaign perspective, we do not recommend that disposable wipes are given to students. They can be used very effectively by staff, but we would not recommend putting cleaning products in the hands of students.
Oh, okay. Not even over-the-counter ones like you get like Clorox or Lysol or...
That's the position that we take.
Okay.
So, but anyway, I would just like to say thank you all so much for all your time. We did go over a little bit of time, and we left a number of questions unanswered. And what we're going to commit to is getting these questions to our panel of experts and implementors, and getting feedback back, getting individual responses as well as trying to post them on our website. We will have this webinar recorded and posted back to our website within the week. And we'd just like to say thank you so much for taking time out of your day and joining us to learn and listen and share about infection control, green cleaning in our schools. Thank you so much to the presenters. Thank you so much to our sponsors. And again, thank you so much for all of the audience members for being part of this today. And we invite you to enjoy the rest of your day. Thank you.
Thank you.
Thank you.